transition to community care. So that was the title which was proposed to me, and I accepted it, the challenge. I risk repeating a bit what has been said just before. So, of course, if you look at the demand preference for care at home services, we have a few factors. First is demographics, so this is no surprise. Second, preferences are shifting towards more autonomous living and care arrangements. In fact, people, if you ask them, where do you want to age, they will not tell you that they want to age in nursing home. So that's a fact. Then you should look also about incomes, and this, the baby boomers are really different in terms of income and preferences. If you compare this generation with the generation just before. When you ask seniors what are their aspirations for their living, number one, keep social and friendly life. So that's something we should not undermine because, as you know, when you age, you tend to be isolated, so alone. And there is a real misery if you are alone because we are corporate and social animals. So being alone is something which is really terrible. Number two is stay in good health, of course. That's wishful thinking maybe, but that's probably true. And three, keep their autonomy. And of course, when you ask people, 80% people link nursing home with the idea of losing autonomy of choice. They are obliged to go there, they are not willing to go there, mostly. And if you ask people also, and that's in echo with what Michael said, people want to stay at home for 70%, even if it's a challenge for most people to stay at home. And we'll see it may be also economically not very efficient. So giving these constraints, you can see on the left side where Korian is positioning itself and in terms of services. So of course, historically, Korian is inside the walls core business nursing homes. So in 2016, it was 80% of the business, nursing home, of the turnover. Now it's 64%. Medical care services, it was to be 20% in 2016. Now it's 25%. And so alternative housing and outside the walls senior care for Korian in 2016, it was just non-existent. It's today 11%. So basically, what we have grown in the last years is really alternative housing and outside the wall services. And why? Because we found out that if you look demand and supply for alternative housing, you find that in most countries the just supply is not there, and we have white spots existing in the market, and white spots also due to two things: lower to medium income segment are underserved by private players. Private and public players, but private players as well. Rural areas, most people and elderly population proportion is very high in rural areas, yet it's not where people and private operators invest. They prefer to invest in towns, like assisted living. You will see, or nursing home. It's big accommodations, 100 flats or more. But it's in towns, not in rural areas. So what we did is that we in 2018 we made the acquisition of HGV, and that's now what I want to present you is it was a co-living, in fact, co-living company just based in the eastern of France. And we liked this concept, and we wanted to. We liked so much that we wanted to develop it over France first, and then we'll extend in other countries in Europe. So when we look at the selection criteria for HGV, geographical footprint, municipality greater than 1,000 inhabitants. So it's very small, but it should be at least 1,000 inhabitants, with local health ecosystem for pharmacy, nurses, doctors, and of course at the minimum grocery store or supermarket, convenience store, everything that can support a living. The presence of a Korian home care facility was also something which helped in developing our networks. As you see, CSR for us is very important, not only for us, but also for investors or for bankers, or and because we don't develop alone, and because we have also convictions ourselves, we have seen that this product is really compatible with ESG. So for environment, we got certified all the homes for high performance. HEQ, high environmental quality buildings, and more efficient than average. For social, also, we will talk about it later, but it's the number one problem in the industry in Europe, but in the world, is how to attract and retain sufficient people in the healthcare industry. So basically, our answers are in the concept itself, because I will present you later the concept. It's a two-story building with on the top floor, in fact, large accommodation for the care people, for the caregiver. Bonus system, training courses, and internal mobility are also very important in the system of HGV. So for local governance, of course, we contribute much to local economic life. So now let's go to the concept, just because it's a French concept. It's the key points of the concept are in French, but don't bother. I will go to each one of them for those non-French speakers. So first objective was to propose alternative housing. So when we look at our clients, our residents are at 75% in loss of autonomy and average age of 88. So when we think about co-living, maybe you think about seniors 65, 75, no, 88 here in co-living. We allow people who cannot or no longer want to stay at home to stay in their municipality and benefit support. So this concept is working well because in France and in rural areas, as I said, it's too small to have infrastructure, normal infrastructure like nursing home or assisted living. So typically the people who live there, if they need some care, they have to go to 30 kilometers away, 40 kilometers away to the nearest nursing home. That's not just viable solution, and people don't know themselves. They are completely isolated. That's the difference. Here, 50% of the people are from the municipality itself, so they know each other, and the 50% are in the 10 kilometers radius. So it's a really local solution. So that's the way it is. So very simple construction, efficient but simple. In cost, it costs about 2,000 euros per square meter to build. So, and because you are in rural areas, basically you don't pay the land, or very little, 50K, not more. If you see, we have on each site, in fact, you have two co-living flats. So you see that it's organized around the central kitchen, living room and dining room, and surrounded by four. In the case of France, it's 4 bedroom on each side, so 8 up to we have some couples, so it's more 8 to 10 residents who will be in co-living. And I think Michael reminded us why is it efficient, and also the person I just forgot the name from America, but affordability, because in fact you share the living together, so the services are together, and the caregivers are not spending time on the road in their cars alone, but they stay with their residents and with their patients here in the care home, in the co-living. We accompany, secure, stimulate, promote autonomy. That's what we do. Atmosphere is good. Why atmosphere is good? Just because people know each other. If you go to a big institution or a big nursing home or a big assisted living, people tend not to know each other and not to know the nurse or not to know the caregiver because it changes almost every day. Here it's different. Here it's a team of caregivers, and the people stay the same in this little area. Cost. So the cost is important. 1,700 euro per month. That's what it costs to be in this kind of co-living in France. So in order to give you a benchmark, a public nursing home in France, on average, it's more than 2,000 euro per month. And a private nursing home in France, it's more than 3,000 euro per month. So it's indeed a solution which is cost efficient for not only for the people, but for the society as a whole. Employees know well everyone's habits. And you can see also that the people are doing everything like at home. So basically, they just buy the groceries and they cook at home. If you are a resident, of course, you have a choice to come and help, do the cooking, etc. Or you have a choice to stay in your bedroom. So that's just a map to see where we are in terms of. So we have already opened more than 100 sites in France, and we will before year end. So that was since 2019, and until year end it will be 32 additional sites. So meaning, in fact, you have to double to count the houses that are considered, because each site has 2 to 3 houses of 8 residents. So just to give you a flavor of what we could do also in with this concept in Germany. I lived myself in Germany for the last 4 years. I'm now back to France, but I'm still continuing to develop this concept both in France and in Germany. So in Germany, we will head for a slightly larger concept. It will be 2 times 12 mostly in terms instead of 2 times 8. So naturally, it will be a bigger, adapted for 24 people and not for 16. Plot size will be a bit bigger. Room size will be the same. The city size, because of urban demography in Germany, it will be a bit bigger than in France. We have many more communes, municipalities in France than in Germany. So on average, they are smaller in France than in Germany. The criteria for land search are the same. Certification, instead of NF Habitat, we'll go to DGNB, Gold or Platinum. And we will equip even more with smart building equipment. So it was said that, of course, digital is important. In terms of help, of course, we think it's important, and we can accompany. It doesn't, for us, it's when sometimes we say it could be a substitute, I think it's more complementary than a substitute to people. And so you can see here what would look like our co-living in Germany for 12 tenants. So basically about the same as in France. You have at the center the living room, dining room and a kitchen with also some laundry room, storage room back of a kitchen, and 6 rooms on each side of the area.